Hello, we are here with our week 13 discussion. I'm going to go ahead and read the situation and then we could talk about it. So, the situation is you are a student, a technologist takes you into a surgery case, and you both set up a C arm. Shortly after the case starts, the surgery tech is paged. They have to go into another case. They ask you to stay in the room and push the button for fluoro if the surgeon asks. And they turn and walk out of the room. What do you do? So I assume this week is about professional development and how we communicate with patients, with techs, and with higher ups and so on. So for me, the situation is obviously like we went over the other week is a little, uncomfortable, a little not safe. So it's important that we communicate our feelings and our concerns in a professional way and don't yell at people or say, "What the heck is going? Like, what are you doing?" We want to be respectful to each other. So, for myself, I would just maybe even off to the side tell the tech, like, "Hey, I'm uncomfortable. Like, I really don't want you to leave. Can you have somebody else come?" Um, I think the hardest part is maybe staying calm when other people are stressed out. I don't know if you guys have had techs who are stressed out and they show it. Like I've had a couple of times where that happens and then that makes me stressed out. So, when people are stressed out, just stay calm. Maybe your calmness will go on to them. Um, One thing that a challenge I did face at the hospital was a tech was stressed out in the ER because they were all alone and it was super, super busy. So they were just like super stressed out. They said like they told us like, okay, guys, no comps right now. Like we gotta go. And they're getting cranky, they didn't eat, they're getting hangry, and they're getting really snappy towards us. So that was like a challenge for me to like kind of hold my tongue a little bit and like not take it personal because it was just them, like they were stressed out. So my professional personality kind of had to change, or I'm like, okay, don't take it personal. It's not you, it's just the work environment that we're in right now happening. But yeah, that's my take on it. How about Felipe? What do you have on that?
Um, so just kind of like referring to the prompt, having been left alone on the fluoro. Um, I agree with you. Just at some point, we will have to kind of like say something, speak up, and it's not going to be easy. Um, Being professional in the medical environment is going to be key as a student to potentially get hired, of course, but also just as an employee and as a coworker. You don't want to come up as like that rude tag or oh he's short tempered. Oh, I don't really want to work with him because they're just they're not easy to work with. You don't want to do that, but you also want to definitely like you were saying you have to speak up. You have to find your voice. You have to find your way to make sure that if you're not comfortable or you say something. I know one of the techs, I think we were first trying an L spine and it was a larger patient. And I was like, okay, the bones are the same size. Like, it's fine. Like, so everything's like, so I should, because I've done so many, I should be able to be comfortable with it. But I told him, like, you know what, like, can you help me? I don't think I don't want to over. So the way I said it was like, I just don't want to have to reshoot it and repeat it when we could probably try if you can help me and get it right the first time. So instead of me saying like, hey, like I don't feel comfortable, like you have to find some other way and get creative with it. And so that was, one of the way I did it. And so kind of looking at it as from like a personal goal. Yeah, I respect that. They're like, oh, they thought I was confident enough that I could do it on my own. So I felt great. But then it's important to know when to say, hey, I need a little bit of help. And so at some point, I feel like they're going to look at us like, oh, you're confident enough that you can do this on your own. And so you should be able to do this. Although we're still students, there's a limitation to it. But I think one of my goals is to make sure that, at least for me, I develop that and demonstrate that so that at some point they're like, okay, you can do this on your own and they'll be comfortable with me saying, "Oh, he left his first year like he did good." So that was me. For me, that's my personal goal to be able to demonstrate, that I am competent. in everything they're showing us and they're helping us to grow it.
Yeah, that's kind of hard. Sometimes I think for me, like with those situations, depends on the tech because some techs are like super encouraging and they're like, just do it, like you got it. And that helps me be more like confident in what I'm doing. And there's some people who just like don't say anything and just like staring at you. And I'm like, you're making me nervous. I need help. Like, but yeah, that's a great goal to have. I appreciate that. All right. Danae, what do you got?
Yeah, so same thing, Felipe, or a similar concept of like being able to verbalize professionally in a way that is not like, you know, coming off as like being, because we want to be confident in what we're doing and everything, but it is okay to stop and be like, oh, but I have been in a scenario where there are some texts where they just look at you and they're just like, go, and they don't like, really step in, and sometimes it's difficult. But yeah, having to set boundaries in a clear way is also kind of been a goal of mine, and I've been kind of working on that too. But going back to the C-arm thing, the scenario about that, I remember Professor Steele, just to kind of add to that, had mentioned last time that most of the time the techs don't know like the rules and the policies for our program, because it's sometimes it's been a while since they've been in it. So they don't realize like, oh, like that's not allowed. So yeah, sometimes we just have to remind them like, oh yeah, per the policies and procedures for our program.
Yeah,
So
no, that's a good point because sometimes even though like I've had an instance where it was me and another student from a different place and one of the techs was off and there's nobody there and she's like, "Oh, can you guys do this KUB without me here? Like nobody's here. Can you do it? I have to leave." And the other student said, like, because I haven't comped on it or anything, so I was like, I totally can't. Like, even if somebody was here, I totally can't. And the other student, he's a second year from Gurnick, and he said, like, oh yeah, I could do it, but like you're supposed to, like somebody's supposed to be here. She's
mhm.
like, well, nobody's gonna be here. Can you just do it? And he was like, sure, yeah. So like those are instances where like even if they know, like sometimes they don't care.
Yeah.
Like it's we can only remind them so much about the rules and I don't know. Like sometimes they want to follow them, sometimes they don't. So it just depends. But yeah, it's a good point. All right, let's see. Kaylin.
Um, with this prompt, I think that so like the problem is kind of how you guys really touch base that we want the text to like us because in the end we're gonna need their help, the hiring process, and um we want to not disappoint them and we want to do everything that they say, but we also have this other side where we have to stay professional, and we have to follow our own rules. So I think it's just like finding like a happy balance between the two. Um, and that's something that I kind of struggle with. Like I always try to just please everyone that's there and like they're the boss, like we have to follow them, but then we have this standard. So I think with this prompt we try to voice up how we were talking about last week, and then maybe also add like having a conversation with another higher up on the side later and coming to them, and just expressing your feelings about it. For me, I think that I need to make a goal of sometimes I get too fast with my words and I kind of like over say what the point I'm trying to get across and I mix up my words. So I need to work on that and then just like being slower with my conversation and then I'll look more professional. But I think that you guys covered a lot of the bases of this one and yeah, I think it was good.
Yeah, so talking fast, I get that
Mhm.
sometimes too. Like my brain is just trying to like get everything out. And sometimes I talk super low, like because I'm nervous, like, oh, can we do this? And they're like, what? And I'm like, just trying to be more confident in that. But that's good. That's a good personal goal. Does that follow into like patients too, or is it just with like the texts?
Honestly, I don't really have that with patients, but just like my higher up like bosses, like all throughout my past, I feel like I've been like even just asking for a raise, like so nervous, even though like I know I deserve one. I've been working so hard, but like just having that conversation and the nerves and like I remember my old boss would just kind of he's like, yeah, we'll talk about it, and then would push it off. So then over time it was like building all these nerves. Um, but it's something that I'll get used to eventually, I hope. But yeah.
Yeah, those tough conversations are hard. Sometimes I think of like people who do have like bad experiences. Like that must be really nerve-wracking to like talk to your preceptor or even like your supervisor and say
Mhm.
like this, this happened, like I really don't feel comfortable or like it, like those are tough conversations to have. And I hope people are having them if that ever happens to you guys. Okay, Bibiana, last one.
For me, I think like you guys said, everything you guys said, it's right. I mean, we have to speak up, but we have to say it in a nice way. And also we have to let them know that we're our first year and we can't be alone. Because I feel like I had this like experience where the tech left me alone and then I didn't do okay. And then another tech was like, if you're not feeling okay, just let them know they can't leave you alone. And I was like, I mean, like I didn't speak up for myself, so I was like, it's true. You gotta speak up in a nice way that like, don't leave me alone. I don't feel good. I mean, I don't want to do it alone. You can be there, but don't leave me alone. So I do feel like we have to speak up and tell them like, it's my first year. I don't feel comfortable doing it. And can you stay here? So, and another experience is like some texts are really fast. Like they go in and they're like done in a minute. And I'm like, when I do it, I take my time. And I feel like if I take my time, I'm thinking on my steps and I feel like I comped like what I want to do. And if I go with some tech that they're so fast, like I feel like I failed. I was like, let me just do my steps so I can do right. So I don't know. It's like that's my goal to like speak up and tell them, you know what, I feel I can do it, but I'm gonna take some time if you don't mind. Like just give me some time because I feel like I can do it, but I get stressed, I get nervous, and I want to do it as fast as they do it, but I can. So I feel like that's my goal to speak up. Like I can do it, but give me some time. So yeah, I feel like speaking up and saying it in a good way, the communication and not being afraid, it's like what's gonna get us in a
Yeah.
good
Yeah, that's a good
Yeah.
point, especially if you go into a patient room where like the scenario is all bad, like you can't
Mhm.
move, or and then you have to like think outside the box, and that takes time. No, I
Yeah.
agree. One of the texts told us if you try comp with me and you hesitate or you take too long, it's a fail. I was like, dang, lady, okay. So yeah, that's a good point too. But also, like, I don't know, I've had also a tech tell me, take your time, don't let anybody push you around, or you know what I mean? Like, just do it right. And I'm like, okay. So I think with everything here is the happy bounce that Kim was talking about, just trying to balance everything out. Okay, any last minute comments, pitch-ins, anybody? Nope. All right. Have a good day.